here we are going to talk about the analgesia, right? Or antipyretics. So to give the focus on the name, we can understand what are the indication of this group of medication. So antipyretics means the medication what we use to reduce the high body temperature or reduce the fever. This group of medication like acetaminophen or aspirin, we also call analgesics because we use it to reduce the pain. So here we are going to focus antipyretics and analgesic. The first one is acetaminophen. Most common drugs we buy over the counter. So acetaminophen we use for pain medication. We use it to reduce the body temperature or fever. And also we can use it for arthritis or gout pain or rheumatoid arthritis. The acetaminophen has a properties to reduce the inflammation as well. So it is the use of acetaminophen. So now let me go back here and some NCLEX note. So we do not give acetaminophen to the patient who kidney does not work or liver does not work. So in case of the liver failure or renal failure, they are not a good ideal candidate for acetaminophen. If the patient overdose of acetaminophen, we could use the antidote. And antidote is called here acetylcysteine. So antidote is called acetylcysteine. So now you can ask me, if overdose occur, how can I understand it? Overdose signs are weak pulses and cold skin. We call clammy cold skin. It indicates patient has an overdose of acetaminophen. Then we give them antidote. It is called acetylcysteine. What next? The common side effect. Overdose can cause liver damage, can cause nausea, urticaria, rash, and jaundice. Second drugs in this group are aspirin. So aspirin has a properties for antipyretics. Aspirin we can use as a analgesic, right? And another popular use of aspirin are we use for blood thinner. Let me recap it. The indication of aspirin for use as a pain medication, usually mild to moderate pain, we use the aspirin. For the fever, we can use it to reduce the body temperature, or for arthritis, gout or rheumatoid arthritis. And also aspirin has a properties to protect your heart because they are work as a blood thinner, right? This is the indication of aspirin. So now question and NCLEX note. So aspirin do not give with other anticoagulant, and do not give the children with a flu-like symptom because of chance to develop the Reye's syndrome or Reye's syndrome. Very important for NCLEX board exam. So they can cause the Reye's syndrome, especially the children, because they have a severe allergic reaction they can cause. Okay. So if your patient have a plan to go for any kind of major surgical operation, it is good to stop taking 1 week before any kind of surgery. Aspirin is contraindicated for gastrointestinal bleeding. Very important. So now let me read it first. The common side effect of aspirin. Severe allergic reaction include rash, itching, difficulty of breathing, or tightness in the chest, swelling in the mouth, face, lips, etc. Black or bloody stool. If the GIT bleeding is occur, blood is mixed with the stool. Patient develop confusion, diarrhea, dizziness, drowsiness, hearing loss. Also, ringing in the ear, severe or persistent stomach pain, unusual bruising, especially the children. As I told you, we do not give to the children with a flu-like symptom because of develop the Reye's syndrome in the children, or also respiratory alkalosis when patient has a toxicity. So what are the nursing implementation or intervention? So if your patient need acetaminophen or aspirin for a long time, it is good to monitor the liver function test, LFT. LFT stands for liver function test. So it is good to educate your patient to avoid alcohol with aspirin. Antidote we use for acetaminophen is called acetylcysteine, right? It is the antidote if patient have a toxicity. Sometimes we can use the mucomist, and also it is good to educate our patient, take the aspirin or take the acetaminophen with food, and also we could report the patient if we can see any kind of bleeding sign. Okay, we could notify to the healthcare provider.